Welcome to the award-winning Women in Healthcare Leadership podcast series brought to you by Medscape Education. Our mission is to educate, advocate, and inspire women in healthcare to lift as they rise. Each episode brings you voices of leaders who are breaking barriers and leading the way in advancing women's health. Join our global community of listeners as we hear from her. Ready to be part of the movement? Let's dive in.
Welcome to today's episode of the Women in Healthcare Leadership series. Every week, we're amplifying and elevating the experiences, perspectives, and insights of women leaders to advance women's health and gender equality. I'm Shanti Vaughan, Director of Clinical Strategy at Medscape, and I'm excited today to be talking about female leadership in the field of vaccines. Joining me are two incredible women leaders in this field. The first is Dr. Kelly Moore, President and CEO of Immunize.org. Immunize.org is a US-based nonprofit organization that works to increase immunization rates and prevent disease through education designed to enhance the quality and safety of immunization services. And we have Dr. Piyali Mukherjee, the Vice President of Medical Affairs from Moderna Asia Pacific, a company we've all heard about because of its leadership in the mRNA vaccine space, a technology that contributed enormously to getting us through the COVID pandemic. Moderna has been at the forefront of vaccine development, covering other diseases such as RSV and influenza and CMV. So welcome, Kelly and Piyali.
Thanks so much. It's a pleasure to be here.
Great to be here with you.
Today, we're going to discuss your personal journey as a female leader in this very dynamic field and why vaccines are important to you and your vision for the future. So let's get started. Kelly, how has your background and experience enabled you to become a leader in the vaccine field? How did you decide to move from public health into immunization advocacy?
Well, my path started growing up on a family farm in Alabama, which required a lot of hard work and practical problem solving, and also learning how to live with disappointment because sometimes Mother Nature upends all your best efforts. So, those were good lessons to learn in childhood. By the time I was graduating from college, I had traveled around the world as a Vanderbilt traveling fellow, looking at the art of healing in different cultures and understanding how different people in different communities solve the same kinds of problems. But then when I hit medical school was when I really discovered primary prevention and vaccination. And I became really focused on what makes the right thing to do the easier thing to do. Back in the 1990s, when I was in medical school, one of my professors commented that 95% of people dying of infectious diseases in the world at that time were dying of diseases we already knew how to easily treat or prevent. And that resonated with me. And at that point, I committed to focusing on implementation of the research that we knew would save lives, rather than being someone who was working further upstream on the development of those innovations myself. I wanted to make the right thing to do easier to do. And vaccination was a natural fit for this kind of inclination. So I went on to train at CDC as an epidemic intelligence service officer, working on the front lines of 9/11 and the anthrax response back in 2001, before moving on to serve 14 years running and building the Tennessee immunization program, delivering vaccines to people of all ages across the state and figuring out how to effectively implement the recommendations that were being made by the ACIP, the CDC, and actually then becoming a voting member of the Federal Advisory Committee on Immunization Practices. So I ended up both focused on operationalizing recommendations and shaping those recommendations. And then that led to work with the World Health Organization as well. So in 2020, I had the opportunity to move from government service into the nonprofit sphere as an advocate with immunize.org, which at the time was called IAC. And I used my experience supporting healthcare professionals for my whole career up until then to really help them focus on what they needed to do a better job delivering vaccination nationwide. And after all of these years, I am still focused on making the right thing to do, the easier thing to do. So that's a bit of my background and how I ended up where I am today, pulling everything together and focusing on getting the job done.
Thank you, Kelly. That's quite a prolific journey that you've had. But I can see how all of these places where you've picked up influence and picked up inspiration that's really culminated in your role at the moment. So Piali, what about your career journey? Can you tell us of any particular experiences that have led you to your current role?
Sure, Shanti, I'll do that in a moment. But first, I just have to say, Kelly, what an amazing journey and the incredible work that you're doing to ensure the last mile delivery of vaccines into arms. Wonderful. And to share a little bit about myself, I began my journey as a frontline healthcare professional, as a doctor, working in a small clinic in south of India. And this is where I was encountering the impact of infections every day. And this is when a flu infection is just not like 2 days in bed, but it's about daily wage workers not being able to go to work, so there's no food for their children. And this is where you really saw the power of vaccination. And yes, it was also the time in life when polio eradication programs were really underway in these countries. And I was very fortunate to be part of that program. So when I moved into the industry, it just seemed that vaccines were the right place to go, because if you see where innovation meets public health, vaccines is really the place which has a massive impact. So I did do different roles in different organizations, both in the country, in different regions, and also in global. And now, in my current role in Moderna, I would say I'm in that fortunate place to be working with vaccines once again, back in my hometown in Singapore. So I work to manage medical affairs for to ensure that vaccines reach people in the important Asia Pacific countries.
Wow. It's amazing because I think there are a lot of parts of both of your story where there are connections. And I also feel it for myself because these are also factors that come into play. The reason why I went into infectious diseases. And it's just beautiful to see that even though you're both from places that are quite far away, and there's still so many things that resonate so strongly about your stories.
It really is extraordinary to see people from such diverse backgrounds, but we share that common vision.
Yeah.
And I think it's because we can see the power of an intervention that doesn't require people to change their lives or lifestyles, but a vaccine simply protects them invisibly and allows them to continue their lives. And I think wherever you are in the world, you see the power of that, and it's quite moving.
So Piali, how do you balance the desire for vaccine equity? Because as you just mentioned, it is important to you. It's one of your driving factors, and the financial obligations of a pharmaceutical company. So it does cost a lot to develop new technology. How do you balance this, and what's your view on this?
Yes, equity and access is very, very important in vaccines, because if you have vaccines sitting in warehouses or refrigerators, it's no good. It's not protecting anyone. And therefore, in Moderna, as an organization, we work very closely with governments and public health partners, and also local partners, to ensure that there are programs in place that vaccines reach people and vaccination is occurring. Shots in arms are going in to protect people. I would say the big advantage of Moderna is its platform. You have the mRNA platform, and which is such a unique platform. And this has actually helped in improving access world over. We saw that during the COVID pandemic. And if I try to explain it, in a traditional vaccine manufacturing facility, it's huge. It's like a little township with thousands of people working in it. In contrast, an mRNA facility is far more compact. It's like, I would say, a parking lot of a shopping complex. It's that small. And this really allows us to move faster and at pace. And that allows access to different parts of the world. At Moderna, another thing that we have done is we have really put our manufacturing facilities across the globe. So we have our main manufacturing facility in the US, but we also have different manufacturing facilities in different parts of the world, such as Canada, UK, and Australia, where we are setting up. And this will really ensure that we are able to supply the global needs if there is a requirement. And even everyday vaccines can be supplied to all parts of the world.
I'll just add that in response to that, I think the agility of that mRNA platform that allows you to adjust and adapt as needed, as viruses change and to react to what's happening, much closer to real time than almost any other platform we have, and then to produce, vaccine at volume to get that out there, it's extraordinary. It's truly been a game changer in the last few years. It's really inspiring to think about what could come next.
Yes, Kelly, the potential is immense.
I remember at the beginning of the pandemic, there was an access issue because it was difficult to deliver in certain areas because of the cold chain. But I think as time went on, that resolved, and it goes to show that even though there might be some limitations with a new technology, over time, it didn't take very long, and those can be overcome.
Yes. That's the promise of mRNA. And during the pandemic, from identification of the sequence to having a vaccine available in market, the time duration was just 11 months. And the word has been used many times. This was really unprecedented. The speed at which a vaccine could be brought into the market was amazing. And this was only possible because of the mRNA technology.
Kelly, um, could you please talk about your work at immunize.org? So this is an organization that it was founded by a woman, Deborah L. Wexler, in the 80s. How has this organization changed over the last 30 years?
Sure. Well, Dr. Deborah Wexler is really an unsung hero of immunization practice in the United States. Back in 1991, she was in clinical practice serving a largely immigrant community in St. Paul, Minnesota, in her hometown. And she witnessed outbreaks of measles and mumps that were really due to barriers to access to vaccination that were being experienced by her patients. And she began at that point focusing on education and advocating for better access to vaccines. And by 1994, the CDC had begun funding her educational work, and the new federal Vaccines for Children program in the United States then made all recommended vaccines affordable and accessible to all children. And so she then was able to focus not on access, but on implementation and improving vaccination rates through this new program. Back then, she started writing a newsletter called Needle Tips that was printed. They printed tens of thousands of copies and mailed them to medical clinics all over the United States quarterly. And now, our website that we talk about now, which is also the name of our organization, immunize.org, appeared on the internet back in 1996. We were the first non governmental site on the internet that did any sort of immunization education. And we relaunched our latest web platform at the end of 2023. We now get over 30,000 visits every day to our website looking for our educational resources. Nowadays we focus on supporting healthcare professionals in the same way we did back in the 1990s with our physical resources, answering questions, giving practical tips on how to vaccinate effectively. We deal a lot with storage and handling issues. Our free weekly e-newsletter, IZ Express, goes out every Wednesday morning to the email inboxes of more than 50,000 subscribers with content that's focused on the educational needs of frontline vaccinators. And it takes about 10 seconds to subscribe to IZ Express for free on our website if people are interested. We also are now utilizing short educational videos in addition to our print ready clinical resources for patients and job aids for healthcare providers. And one of our focuses is also on making sure that information is accessible to people who may not use English as their primary language. We offer free translations for the federal vaccine information statements, known as VISs, in dozens of languages, all of them very convenient and always free to use and distribute. So over the more than 30 years we've been around, we have seen immunization schedules become much more complex. We've seen patients and parents have many more questions and concerns about vaccination, and our role has really become more important than ever in supporting clinicians to help their patients with all of the questions they have. New technology like mRNA is exciting to those of us who've seen how it works and understand it, but the public has a lot of questions because they're not that familiar with this technology and how it works. And so we're there to help make sure that their questions are answered and people feel confident making the right choice for vaccination for themselves and their families. Um, as you may know, we recently had an unvaccinated but healthy schoolgirl die from the measles in 2025 in Texas. And that's a tragedy that was entirely preventable with a vaccine that's tried and tested and that's been required for school entry in the United States for decades. But this child had an exemption and wasn't vaccinated. Our work, therefore, is really not just focusing on new products, but also reassuring people about the vaccines they've used for many years, because we don't need to see this happen again. And a lot of our efforts now are focused on reaching people who may be very confused by the information they're finding on the internet. We want to be the source on the internet for information that they can count on.
And I think there's gonna be quite a lot of challenges over the next few years as well that need to be overcome. But what are your concerns at the moment?
Well, immunize.org has always focused on supporting clinicians with evidence based information to make wise decisions about how to use vaccines in an optimal way. We have always provided people with the information supported by the CDC and by experts at the ACIP, the Advisory Committee on Immunization Practices. Immunize.org fully intends to continue to focus on being a trusted source of accurate information about vaccines. So, in this space, even if perhaps CDC is less vocal about vaccines or information is confused from other sources, we want to make sure that healthcare professionals know they can continue to count on us for the same kind of evidence based, accurate information that they've always depended on from us. So, in many ways, our mission is one that we're doubling down on supporting healthcare professionals because we realize they may have they may have fewer options about where to get that kind of educational support for a while than they've had in the past. And so we plan to step up and make sure that they can count on us. A good example recently, the vaccine information statements needed to educate patients about the vaccines they receive temporarily went down off of the CDC website, which caused a lot of concern. We saw on that 24-hour period, we put out a notice that we have all the vaccine information statements and their translations on our website, and people can come to us if they need them. We saw the traffic to our website, which on a Saturday is usually about 20,000 visitors on a weekend, jumped up to over 47,000 people visiting our website on that one Saturday, uh, to make sure that they could get the information they needed when it wasn't available from CDC. So that's just one illustration of how people rely on our information, and we want to make sure everybody knows to come to us if they need it.
And very incredibly important work that the organization is doing, Kelly.
Thank you for that, Kelly. Piali, what about the new innovations in the pipeline of Moderna? So what are you getting excited about?
Yes, our pipeline is something that really excites me. It is the reason why I jump out of bed every day because I'm so excited about it. Kelly, you were mentioning this journey with pediatric vaccination, and it's taken about 30 years, and now we are in a place where most parts of the world, you other than those occasional cases that you were mentioning, you have a good, robust coverage, about 80 to 90% coverage. But the world is getting older, and there are increasing number of vaccines for older people, but coverage remains low. So I will share the Moderna pipeline, and a number of our vaccines are really targeting these older populations. So the pipeline in Moderna includes more than 40 assets in our pipeline, but we are being incredibly disciplined about focusing on 10 primary assets that we would want to bring into the market in the next 3 years. And this includes our assets in the respiratory viruses. So we have our COVID vaccine, which is already in the market, but we have our next generation COVID vaccine. And we are anticipating that we will get approval for this very shortly in the next few months on this vaccine. We also have a next generation COVID plus a flu combination vaccine. And we have seen that in the pediatric place, combination vaccines were really game changers because they simplified schedule and they allowed infants to be protected against a number of disease. And this vaccine too has been submitted to FDA and the review process is ongoing. And we hope to have this vaccine, this license, very shortly. And we hope to have the flu COVID combination vaccine also licensed within a very short period. Beyond our respiratory portfolio, which includes the COVID vaccine, the COVID flu combination vaccine, a flu standalone vaccine, and also extension of our RSV vaccine. So the current RSV vaccine is licensed already in the individuals above the age of 60. And we do have studies in the 18 plus age group. And this is the age group that is undergoing review as well. So we hope to extend our RSV indication going down the age to individuals 18 and above who had high risk of RSV infections. Now, beyond respiratory vaccines, we also have vaccines for latent viruses. The most advanced among them you mentioned was CMV. CMV, even today, is one of the leading causes of congenital abnormalities. And this is the first CMV vaccine ever. And we are waiting for our phase 3 results to read out sometime this year. And we are all waiting with our fingers crossed that we hope that we see a positive results for this vaccine. The other very interesting product that we do have is a norovirus vaccine. And like the CMV vaccine, this is also a first in its class. And recently in the US, there has been a surge in norovirus infection. And like many viral infections, norovirus usually impacts the very young tiny infants before the immune system has really matured, and the older population as they undergo immune aging. So these are the few vaccines which are in advanced stage of late phase 3 programs. So beyond that, we also have our vaccines for rare diseases. So we have a couple of vaccines in advanced stages, and this includes a vaccine for PA, propionic acidemia, and MMA. So these are genetically inherited diseases. They are very rare. And today there is no treatment for these poor infants who are born with these diseases. And these vaccines are really therapeutic vaccines, which are game changers and totally allow these individuals to lead a life which is totally different from the quality of life that they currently experience. And finally, we are also in the area of oncology where we have bespoke vaccines, I would say. And this is our individualized neoantigen therapy. And this is a program, our leading program, and this is in malignant melanoma. And we are once again waiting for the results of the trials to come by. So these are our main 10 lead candidates, and we hope to get these 10 vaccines into market in the next 3 years. And this once again really showcases the power of the mRNA platform because this is the only reason why a pipeline with this speed is made feasible. And this is the power of the platform.
That's incredible, Piyali, and I personally I some of these are new things to me, and it's so exciting. I must say, personally, I'm a really strong supporter of that norovirus vaccine. As someone who, for some reason, is especially sensitive to norovirus infections, even though it may severely affect the very young and the elderly, people of all ages are miserable with the norovirus infection. So we'll really be looking forward to hearing your results and seeing what comes out of the pipeline in the next couple of years.
Yes, Kelly, we share your enthusiasm and we are waiting for most likely end of this year or early next year by when we should have our results for this.
Exciting.
So, Kelly, let's circle back to the theme of the podcast, which is women's health. What do you think are the biggest gaps in disease prevention when it comes specifically to women's health? And then also, what do you think the role of women is in immunization advocacy?
To take your second question first, I think women are natural leaders in immunization advocacy because traditionally, women are the people who, in our communities, zero in on keeping others safe. Whether they're insisting on children wearing bicycle helmets or wearing their seatbelt or washing your hands before dinner. And, it tends to be the woman's role to look for that safety and prevention, protection. And immunizations are all about keeping people safe from serious harm, and protecting them in advance. In addition, moms are generally the ones who are responsible for keeping up with their child's immunization schedules, in partnership with their child's pediatrician. So women have a very natural role when it comes to safeguarding the health of themselves and their families. But going back to the first part of your question, one of the biggest gaps we see between the potential and the reality of disease prevention for women is actually vaccination during pregnancy. I think many people have thought that pregnancy was a period of time where it was somehow not safe or not good to be vaccinating. But in fact, we know that there are several vaccines that are crucial to the health of both mother and child that we want to give during pregnancy. An example is that the most effective way to prevent a dangerous case of whooping cough or pertussis in a newborn is to vaccinate the mom during pregnancy. But the problem is that nearly half of women don't get the Tdap vaccine during pregnancy. In more than half don't get vaccinated against influenza, and far fewer get the COVID vaccination during pregnancy. But we know that both of these vaccines effectively protect both mom and baby from illness and hospitalizations before and after the child's delivered. Um, in As Piali was discussing earlier, we have multiple options now to prevent RSV infection in infants, the most common cause of infant hospitalization in the United States, including vaccination during pregnancy with one product. But there's still a large unmet need there. A lot of people who are not taking advantage of these disease prevention opportunities. And I'll close by adding that as a longtime advocate for cancer prevention through vaccination, we can and should be doing much better with HPV related cancers, including cervical cancer, with the use of the available HPV vaccines. It's been around since 2006. The vaccine is incredibly safe and effective beyond our wildest dreams, but it's still not being used to its full potential. And we have a lot of work left to do there as well.
Thank you, Kelly. So, Piali, what are your top tips for women to develop a leadership role in vaccines, and how can we set the stage for future leaders?
So, when we talk about leadership in vaccines or in any area of science, I would say that there are two things that are very important. One is to really ace the science, stay on top of it. And we are in such a dynamic environment and things move so fast. Like you mentioned, the mRNA technology is such a new technology. And I would encourage all future women leaders to ensure that they really stay on top of the science, read through the data in detail, and not base their decisions on just sound bites or headline, but really go into the details. I think that's very important. And the next thing is leadership is always about people. It's the people you manage within the organization, ensuring that your team has the opportunity to be the best version of themselves, and also the people we serve in the bigger universe. And this is where vaccines are so powerful. So if you keep your vision focused on the people you're serving, that's the surefire path to leadership. You did ask for tips, and I will give you some more tips to people who are listening to this. And that is that, in your career, there are always opportunities for you to step up, and your job is always much more than your job description. And I have seen several times in my life that when there was a vacancy and I put my hand up that, okay, can I cover for that additional bit of work? That's when you get noticed and your leadership shines through, and that really opens doors. So I'll encourage all future women leaders to come on, go take those opportunities and raise your hand. And that really doesn't mean that you work 18 hours a day, because as we as women have a lot of other responsibilities, but it is to remember to do the most important thing and to let go of the small things. So keep your focus on really impactful things, and always remember it's always about the people.
Thank you, Piyali. And then I have the last question. Thank you. Who are your heroes in the medical field in terms of advancing medicine or advocating for health equity? Is there any individual that you feel is really inspiring?
Kelly, would you like to go first?
Sure. I can start. There's so many that I've had the opportunity to work with in my career, and it's difficult to narrow down. But one I would highlight is the late Dr. Paul Farmer, who was at the Harvard School of Medicine and founder of Partners in Health. And he was incredibly influential during my time at the Harvard School of Public Health. And he really taught me to focus on the fact that the people suffering the most should be the focus of our best work on both an individual and a population level. And I've also been touched by some terrific medical teachers who really invested themselves in mentoring me, despite the fact that they had their own work and focus and reputations, but they took the time out to support me. And Dr. Kathy Edwards is one of those. She's a professional mother and grandmother to a generation of vaccinologists all over the world. She gave me my very first experience in influenza vaccine program implementation as a medical student. And today she serves on the board of directors of immunize.org. I'd love to name so many more, but I'll stop there.
Yes, and I'm very fortunate. I had my paths have crossed with Dr. Catherine Edward, and she's really inspiring. I would say that I am really inspired by the everyday heroes, doctors who are practicing, but who are not just treating the symptoms of their patients, but the patient as a whole. And that's where prevention comes in. And if there is one particular name I would like to call out, it's late Professor Tobias Welty. And Tobias Welty is not a vaccinologist. He's not an immunologist. He's actually a respiratory physician. And he was really a pioneer who brought vaccination as a central topic into the universe of pulmonologists. And today, all leading global guidelines for COPD or asthma include an entire section on vaccination. And this is really thanks to him for bringing in vaccination as a preventive tool into the field of respiratory medicine.
Thank you to both of you, Kelly and Piali, for joining me today in this timely discussion, particularly since it's approaching World Immunization Week. The topic of immunization has historically been complex. It's been one of the most important advances in medicine, preventing millions of deaths each year, but there's always been different public narratives to contend with. It's been a pleasure to listen to your stories, to your journeys, and just for the audience to know, this conversation is spanning over 3 different time zones across the world. And although we have really different backgrounds and different paths, what was the most striking to me was this shared vision for improving health and life through vaccines. It's been such a great discussion. I'd like to thank you both for joining me today, Piali and Kelly.
Thank you for the opportunity. It was really great to contribute to this important discussion.
Yes, it's been a pleasure. Thank you.
And also, thank you to our audience for listening. Please watch out for the next episode of the Women in Healthcare Leadership podcast series.
To our listeners around the world, thanks for joining us today. Tune in as we continue our journey to amplify the voices of women leaders in healthcare. Hear From Her is brought to you by Medscape Education. Please subscribe to Hear From Her on your preferred podcast channel and follow us on LinkedIn. Until next time, remember to lift as you rise.